Internet was the key. Every day I receive a lot of mail by patients that want to know something about eye problems. And I've seen that a lot of them have suffering of myodysopsia. And I have seen that they are very desperate of this problem. Now I look for internet the references about this problem, and I have seen that some ophthalmologists in the world practice the technique of vitreolysis with UV laser. I bought the Karikov book, and I read the protocol of this technique and understand to practice this technique. I started to practice it, and after 2 years I write to Scott Geller in Florida, and I was gone in Florida to see the Geller technique, and I started to perform these treatments. In 1988, when I was resident in ophthalmology, I started to use the UV laser for capsulotomy. And I have seen that sometimes the debris put in the vitreous, drop in the vitreous. And I think that it was possible to treat, to vaporize this debris. And when I heard by this technique, I think, yes, it's possible, because I have done when I was young in the vitreous for the debris. And 4 years ago, I started to perform these techniques. I invited Scott Geller in my congress in Italy 2 times. I organized 2 Scott Geller days when Scott Geller treating my office, my private office, a lot of patients with good result. I've seen this technique. I have performed more than 150 treatments, but with the old laser it was not possible to reach the floaters in the posterior of the vitreous. Now, from 3 months, I have the new laser, Alex laser, and now it's possible to treat more patients with this laser, because it's safer and it's possible to go in the posterior vitreous. The applications of nanosecond pulses of light laser permit to evaporate the clouds, the floater, and to sever the strands and the filament to put off the floater out of visual field. And the collagen fiber evaporate in bubble gas. Bubble gas are absorbed by the vitreous. The goal of this technique is to improve the visual acuity and the quality of vision. In most cases, it's impossible to remove all floaters, but it's possible to improve the quality of the vision. Vitreolysis is performed with an outpatient procedure, not necessary to go in the hospital and to sleep in the hospital. Before the treatment, the ophthalmologist put eye drops to obtain medium anesthesia, topical anesthesia. After, ophthalmologist put a contact lens in the eye, on the surface of the eye and the cornea, and you can look the floaters by a microscope of the laser. During treatment, a patient observes small dark specks that fall down, and these are the bubble gas that go up and are absorbed in the vitreous. After the treatment, it's possible to put eye drop, anti-inflammatory eye drops for the patient, and usually it's necessary 2, 3, or 4 treatments to have a very good result. Patients with persistent moving shadow in the vision with a cloud, with a fiber, with strands are a good candidate for the vitreolysis. In most of cases, younger people suffer for a microscopic flutter too close to the retina, in a zone named premacular bursar. These are not good candidates for vitreolysis because it's too close to the retina. If the flutter symptoms come very quickly, it's possible that the patient have a PVD, posterior vitreal detachment, and this is a good candidate for the vitreolysis because the ring vise is of a hyaline substance and this is more easy to treat with the YAG laser. Yes, the tower illumination design of this lamp converge the operator visual, the target and the beam in the same optical plane. This is very important to have a coaxial vision. An important characteristic of this new laser is that the mirror put off the laser beam when I fire. In this manner, we have a coaxial plane and all energy hit the flutter. The optics of this laser too are superb, and it's possible to see tremendous detail of the flutter. It is easy for me to hit this flutter. Another characteristic of this laser is that have an optical breakdown at 1.8 millijoule. This is very important because the other lasers are 3 or 3.5 millijoule, the optical breakdown, and it's possible to use less energy to obtain same results. I'm very satisfied of this laser because it's easier to use, it's safer, and permitted to treat more patients. My satisfaction is finally to see my patients smile.